Hello, everybody. Welcome to the Decarb launch. We will get started in just a moment. Thank you for being here for this moment of virtual celebration. It's been a long journey, and we are at the beginning of the next phase. Again, thank you for being here. Just as folks are joining, I want to say that we have done all of our workshops and our sessions not as webinars but as meetings, and that has always been intentional because we are forming a community in a sense that is able to communicate and support one another. And while today we are excited to hear from some fantastic keynote speakers who will engage us, we want to keep this ethos of working together to create a community. And so this is meant to be a moment of celebration. I know we are in different places around the world, but we are coming together to celebrate. And so when we have the official launch moment, I am going to raise a toast to the launch. I have my sparkling water ready. And so I encourage you, if you would like, you can grab sparkling water or equivalent so that we can toast the moment when we launch the guidebook. Again, we'll give it just about another 15 seconds, and then we will get started. Michael, it's good to see you. All right, well, let's go ahead and get started. In some senses, the public-facing portion of this journey started on February 9th, 2023, when we had our launch of the overall journey. From there, we had interactive workshops. We had about 10 of them. On topics like the first R, reduce, natural gas boilers, 20th century marvel, thinking outside the code, show me the money, funding decarbonization, and even one, our real decarb journey, and then one that some of you might remember where we had an impromptu debate around technologies. And all of that, we were working together, learning from one another and sharing ideas so that we could create the guidebook. The Decarb Guidebook team, Austin and Jim and Cassidy and Bethany and Charlie and others, alongside our technical advisory committee, have since been working behind the scenes to develop the guidebook. And we are at the point now where we can launch the guidebook. I was told to remind everybody that the guidebook is a living document. I think Walt will talk about that more in a second. And so you can think of this as a beta version. As you engage with the guidebook in a moment, and as you find opportunities to make it even better, I want to encourage you to do that, for indeed, that is the point. We are at the starting point of a journey towards decarbonization and having a technical tool and a motivation tool that will help us get there. And so the point today is really just to celebrate. So I'm hoping to see your smiles in your faces, to see your comments in the chat, and ultimately to have a moment of celebration for the work that we have done thus far and the work that we're about to do. And so Charlie, if you just share the agenda really quickly, you were going to hear some introductory remarks from Walt Vernon and from Cecilia. We will then hear our keynote engagements from Dr. Zhao and Dr. Jackson. At that point, depending on timing, we may put Dr. Zhao and Dr. Jackson into a brief conversation together. I'll share a little bit about a motivation tool that we hope this community will use, and then we'll have the moment we've all been waiting for, the official launch of the guidebook. From there, we will turn to Austin, who will do a demonstration of the guidebook, and there will be some surprises in that demonstration depending on time. With that, I'm going to get out of your way and first introduce Walt Vernon, who's going to share some remarks. Walt?
So I am the CEO of Mazzetti, and when we got the RFP from the California Energy Commission to write this guidebook, I was really thrilled at the opportunity and worked hard with a number of people to try to envision what should a guidebook be on this incredibly important topic. And one of the things we decided was we wanted to do something more than just a printed document that would probably be out of date the day we hit the print button. And so what we envisioned was the creation of an online community a community of practice, if you will, that would live past the grant from the California Energy Commission. Mazzetti is a benefit corporation, which means that, and our vision is to bend the climate curve. So unlike other, I guess, for-profit companies, we are required to be investing in the public good. And so part of our vision was to take this work and really launch it as a community of practice so that all of us could continually learn and improve in a Wikipedia kind of way. And one of the things that's been really exciting about this in terms of sort of generosity, if you will, we went to the California Energy Commission and we said, hey, listen, this guidebook is somewhat constrained because it's the state of California. And ASHRAE wanted to create a guidebook for the whole country. Would you be willing to give this material to ASHRAE to launch their guidebook, which would be relevant, as I say, to all geographies? And they were quite willing to do that. So the work here really does continue and will have such an impact. And I hope it's a source of learning and inspiration for everybody. And one of the people who helped make this all possible was Cecilia from Healthcare Without Harm.
Thanks, Walt. Just a couple of words from our perspective. So I work with Practice Green Health, which is a nationwide network of hospitals and health systems committed to moving sustainability and environmental stewardship forward, and our sister organization, Healthcare Without Harm. And we've had a long and storied history partnering with organizations, so forward-leading organizations like Mazzetti, who've always been thinking kind of at the cutting edge of where this work is going and thinking about how to move this work forward. Healthcare is really at an inflection point. After doing this work for about 25 years, we are now seeing, all the right players come to the table, and it's really exciting and at moments overwhelming to see all those players come onto the field. But from the incredible work at the National Academies of Medicine, the Institute for Healthcare Improvement, we see Joint Commission, the CMS, HHS, I can rattle off all the acronyms that would really tell you why this work is happening real time. The American College of Healthcare Executives is holding trainings around the country to talk about how we decarbonize. And I think we've reached that tipping point moment from spending less time convincing people why they need to do this work, although certainly that is important, but also being able to flip over into how. What are the strategies that are really going to get us there? Because I think we all know time is of the essence here. And even to achieve what some are even calling a low bar of 50% reduction in emissions by 2030, we're going to have to move fast. We're going to have to take advantage of all the financing opportunities that are out there. And we're going to have to partner with forward-leaning organizations like Mazzetti to think, how are we going to get this done real time? So from our perspective, I think we're really excited to see this guide come out, talking about, building design and efficiency, demand reduction, and really beginning that dialogue with the healthcare leaders within our organization, how to finance this work, how to, what are the strategies and low-hanging fruits that we are going to tackle first. So we're excited and delighted to use that within our own learning network. And we think it is an important stepping stone toward really hitting these aggressive goals to decarbonize the healthcare sector. So thank you for having me. I'm delighted to be here for the launch and excited to hear our colleagues speak.
Cecilia, thank you so much for your continued leadership. We'll now turn to hear from Dr. Jackson, and Walt Vernon has the pleasure of first introducing Dr. Jackson. Walt?
Yeah, I don't want to steal any time from Drs. Jackson and Zhao, but I will say I first heard Dr. Jackson speak at a CleanMed conference from Cecilia's organization, and I was shocked to hear a clinician talking about the climate. And I remember him talking about being a pediatrician and being able to see a spiking fever when he saw one as an indicator of health, and how impressed I was by his leadership. And Dr. Jackson is especially important to us in California because he was the chief public health officer for the state of California for many years. He's been a professor at UCLA in environmental health science, and just I could go on and on. Dr. Jackson, why don't you take over?
Well, what a pleasure it is to be with you all. And I want to thank Mazzetti and Healthcare, et cetera, for the Decarb project. I think it is so important. You know, I lived in Berkeley, and when I'd go to Sacramento, I quickly learned that if you're in front of the legislature, never say you're from Berkeley, because everybody thinks people in Berkeley are nuts. And so I had to talk about, and yet Berkeley is the place where there were the first curb cuts, the first anti-smoking efforts, the first school gardens, and the first soda tax. And so over and over again, we end up being the leader. Well, then I went to Washington. I was at CDC for a total of 15 years, 9 years as the head of environmental health. And I'd go in front of Congress, and I was told, don't say you're from California, because the whole country thinks California is kind of strange. And yet the cutting edge, just as the Energy Commission has done with Decarb, the cutting edge is almost always California. In fact, the rest of the country waits for us to do something. They make fun of us, and then they go ahead and do whatever we were trying to be doing in the first place. I'm going to ask a quick question, and it'll be my theme here, which is, what is your biggest surprise about climate change? And early in my time at CDC, I was up at the White House a lot, and got to know Bob Watson, who was the head of the Office of Science Technology Policy. And he wanted to talk to me about MTBE in gasoline. This is an oxygenate that if it the gasoline spilled on the ground, the MTBE and ether smelled and tasted terrible, and it ruined the groundwater in many places. And so I'm talking about this ether oxygenate, and he goes, that's not as important as what I'm going to tell you about. And he began to speak to me in great depth about the threat of climate. And it all seemed kind of remote to me. And, you know, this is almost 30 years ago now. And so my biggest surprise, and think about your biggest surprise, my biggest surprise was that it's happening so much faster than I expected. Here's one of the reasons I stayed in California, even though I'm a Jersey guy, because I just love the Sierra. I love the forest and the nature here. And 10 to 15% of the giant sequoias burned, were lost. These are trees that are sometimes 1,000 years old and almost 300 feet tall with the last fire. Next, please. About 3 years ago. And I remember my family in the East would sort of laugh, oh, California, you had a red day. And I remember getting up that day, and even the dog was out of sorts with how it felt like Mars, to have no sunlight and everything tinged red from the fires that were blowing back over us in the Bay Area. Next, please. And New Yorkers stopped laughing about a month ago, and you can see Radio City and Fifth Avenue right there. And Bosnia-Wash had really turned red as well. Washington was unhealthy, that is not politically, but the air quality. It was very unhealthy in Philly, and it was hazardous in New York City. And we Californians are used to having a go bag by our front door, but I don't think the rest of the country was quite as ready for it. Next, please. And the smoke from these fires didn't just stay locally. We all know this, but look how the smoke was moving north. It was going up over Greenland, and Greenland's melting at a colossal rate. And anytime soot ends up on snow and ice, it melts even more rapidly. And that cloud that was moving with the jet stream was heading over to Europe as well. So this is only a month ago. Next slide, please. We all know that the planet has gotten hotter, but as I look at this, and this is up till 2022, these are numbers generated by real measurements around the world, and more recently with satellite data. But I have an 8-year-old grandchild, and he has never lived in a year that was colder than average. In fact, after 1950, none of us have lived in a year colder than average, but my grandson has now lived in the hottest years on record. The next slide, please. And you all know that over the 4th of July weekend, we hit the hottest surface air temperature in the history of taking recordings of temperatures on planet Earth. The dotted line is the average from about 1990 going forward, about the time Bob Watson told me you need to start worrying about it. I never thought in 1994 that we'd be looking at that line slipping up by half a degree, a full degree. It doesn't sound like much, but when you multiply it times the entire planet, it is a lot. Next slide, please. And we were all focused on, oh, the atmosphere is getting hotter, but this may be even more important. 80 to 90% of the heat that's created by climate heat, basically greenhouse effects, is going into the oceans. And who would have thought that we would see heat changes down a mile in the ocean because of the amount of heat is now, it's basically the buffer, the sink, where the heat of the atmosphere is going to reside going forward. And these are, think about the immensity of the oceans. I remember this grandson holding up a globe and saying, look, Papa, you can look at the planet Earth and you won't see any land if you hold it this way. The immensity of the Pacific, etc. Next slide, please. But one of the temptations we have is we always think, well, we're just looking at the final slide in the film, the final scene. But going forward, we're now looking at over 50 days a year in many of our major cities in the United States, over 100 degrees Fahrenheit. And this is in, my granddaughter that was born a couple months ago, she lives to be 78 years old. This is the world she will be living in. Next, please. I talk about the rapidity of change. This is from yesterday's Washington Post. If someone had said to you 5 years ago that the Gulf of Mexico, west of Florida, was at close to 90 degrees, it's nice bath water at that point, including, and that the rest of it was around 30 degrees Celsius, which is about 85 degrees, none of us would have predicted it. And yet, as the ocean gets warmer, it puts more energy into the atmosphere. Heat is energy, and it puts more moisture in the atmosphere. Next, please. So dumping this moisture and energy into the atmosphere means that we've seen a stair-step increase in very costly disasters in continental United States. And next slide, please. $165 billion for just the cost last year. And we're seeing insurance companies backing away, for example, from California because of fire threats, and also fear up in Florida because of hurricane threats. You can see the hottest years, the colors you see here, with the exception of 2011, are just in the last 5 years of billion-dollar disasters. And by the way, this is CPI adjusted, cost of living adjusted. It's not an artifact of, money yet, of inflation. Next, please. This is this morning's New York Times, the summary of it. Heat below is making the ground shift under Chicago. I never guessed that we would see effects like that into the foundations of our homes in the Windy City. I lived near Poughkeepsie, New York for several years, and I never thought that Highland Park, New York, and those areas would turn into flood areas with storms that are, 7 inches of rain dropped in the last 2 days. And when I was at CDC, my center did the original investigation of the Chicago heat wave. We had 500 to 700 people killed during that wave, but it taught us a lot of lessons about the need to redesign buildings. Chicago's good at dealing with cold weather, but it wasn't really prepared for dealing with hot weather. Next, please. The other thing, I've talked a little bit about the oceans absorbing heat, and you can see the red line is the Keeling curve of the CO2 levels in the atmosphere going up, but it also absorbs the CO2. So the green zigzag line is CO2 dissolved in our ocean. So this is down 2,000 feet. They're finding these very increased levels of CO2. And you all know from soft drinks that if CO2 is dissolved in water, it becomes more acidic. And so the oceans have actually the acidity has increased, the pH has decreased, because that's what happens. And this has real effects in the bottom of the food chain, because for lower level critters on the food chain to form the shells that protect them early in their lives, that acidity has an effect. Next, please. I kind of thought, when I was being taught to go fishing, that you look for the cold, deep pool, and that's where you would find trout. And you stripers, you want to go fishing where the water is, again, fast moving. I thought it was just because it was cool. I didn't realize that it's also because that's where the oxygen is. The fish want to be where there's plenty of oxygen. It makes perfect sense, of course. But as the oxygen levels decrease, and that's what happens because warm water doesn't hold as much air, oxygen, or even CO2 as cold water. So this is what's happened, and you all know that is true for a soda. If you open a warm soda, it goes all over the place. If it's cold, it usually does not. So this migration of food. So fish populations have moved north. When I was a kid in Jersey, you could still catch lobster. You can barely get lobster at Cape Cod now. Next, please. This warming, you've all heard the stories of the loss of the ice sheets at the North Pole and the Arctic, and the loss of the breaking off of ice sheets in the Antarctic. But the third pole of the planet is the Himalayan glaciers, the Hindu Kush. And the snow, the ice there, supply the rivers during the non-monsoon seasons for about 6 of the major rivers in the south of in Asia. Next, please. And here's the UNDP, United Nations Development Program, talking about the loss of the third pole, the Hindu Kush, with 1.6 billion people depending upon that water, at least a good part of the year. Think about the impacts for refugees. The planet had a hard time absorbing 500,000 refugees from Syria. Imagine if we have 1,000 times that number. Next, please. And right now we have about 90 million refugees. About a third of them are children, but this is profoundly politically destabilizing. Famine is destabilizing. Next, please. And this is the United States intelligence community right up front saying ecological degradation and changing climate will fuel disease outbreaks, threaten food and water security, and exacerbate political instability and humanitarian crises. And I had the Refugee and International Health Group in my center at CDC, and it's heartbreaking when you see what refugee populations have to deal with. Next, please. So you all know this, the UN is saying this, but we are very close to a doom loop if we don't really take action, which is one of the reasons I commend the Academy. I commend Mazzetti, I commend Green Health. The US is very quick about telling other countries what to do, but unless we do it, we're not going to make enough progress. Next, please. And so our dear friend Renee Salas and others are behind the Lancet Countdown. And Victor, I understand Renee is going to become the head for our interest group within the National Academies to call for the health community to really step up. Next, please. A lot of folks don't realize that the medical care system now in the US is 20% of the GDP. That's why we live longer than anybody else in the world. Well, actually not. We're about number 37 in life expectancy. But it's all reasons why Dr. Zhao was talking about the many dials that we have to turn down, not just CO2 and carbon footprint, but various disease antecedents that need to be reduced over time. Next slide. And 25% of all the global healthcare emissions are coming from the US health sector. Next, please. And you can see the US's number is second from the top as having the highest carbon footprint by country. I can't figure out why Luxembourg is so high, but we are so much bigger than those other countries. Next. And the carbon footprint of the US, you can see the total carbon footprint is in the US is about 8% coming from medical care, and that's a lot. The way we dealt with lead poisoning in our country was we had to turn down all the dials. We had to turn down, by the way, the gasoline industry said no, it's the paint, and the paint industry said no, it's the pipes, and we had to turn them all down and not point to someone else as the cause of lead poisoning in our children's population. Next, please. And I was surprised by this. This is Jody Sherman was one of the authors of this fine report that pharmaceuticals and chemicals contribute almost 20% of our healthcare greenhouse gas emissions. And there are a lot of things that have surprised me along the way in all of this. I'm sure the rest of you. So yeah, the sources have been a surprise, but also the speed has been a shock. Next. So virtually every major medical nursing professional academy has stepped up and called, and Dr. Zhao has been such an important leader in bringing together the partners that will help health step up. So I think I'm pretty close to next, please. So we're going to have to protect everything. Yes, we have to protect the planet, and that's the best way we can protect people. We figure out that how to have win, win, win. And with that, let me close. And I know I threw a lot in here, but thank you for your patience and your attention.
Great. Dr. Jackson, thank you so much for that presentation and for your continuing leadership in this space. As we launch the Decarb Guidebook, we know that your leadership is important and impactful. I'm going to turn it back over to Walt, who's going to introduce Dr. Victor Zhao. Walt.
Thank you, Troy. And thank you, Dr. Jackson, for your continued leadership. You know, in the design profession, we say that form follows function. And so, you know, part of our job is to provide the platform on which healthcare does its work, and to see healthcare moving in the direction of decarbonization is a strong signal to us in the design community to contribute to that. And I had the pleasure of being in a panel with Dr. Zhao a couple of weeks ago in Washington, D.C., talking about these issues. And one of the things I noted in that panel, they asked me, I only got to answer one question, and the question was, what are easy things that healthcare organizations can do to lower their footprint? And I said, I don't want to talk about what's easy. There's plenty of stuff out there about what's easy. I want to talk about what's important, because what's important is what we need to drive us forward. And my answer was, what was important is leadership. And I have to say, I have really watched with awe what Dr. Zhao has been able to bring to this fight. I think Dr. Zhao, you know, he had a vision to take the National Academy of Medicine and make it not just an organization that writes reports and does research, as important as that is, but to actually become a catalyst for change. And so Dr. Zhao has assembled really in his Action Collaborative to Decarbonize Healthcare, the country's leading voices in the healthcare industry. And it has been such an inspiration to watch, Dr. Zhao, what you have done, and the leadership that you've shown, and the difference that it's making. And I want to hand you the baton with gratitude for somebody I consider a friend and a mentor.
Thank you very much for your kind remarks. And Dick, you know, I've always admired the work you've done, and of course, all the things you've done, and your talk was just absolutely great. But Walt, I want to tell you something. You remember a few years ago, you know, I was still lost in the wilderness, and many of you encouraged me to look at this issue, being the head of National Academy of Medicine. And when I really begin to understand it, you know, you and Dick and others helped me to get to where we are today. In particular, you and Don Berwick and others wrote a very critical and important paper. I think we had this meeting back in December, 2018 or 19, where, you know, that came out of this, that really in many ways set the tone and the stage for what we're doing today. So I want to thank both of you. I also want to make sure I thank the Mazzetti Group, Troy Savage, the whole Technical Advisory Committee, and of course, California Energy Commission for really sponsoring this really important guidebook. What I'm about to tell you, you quickly realize how important this guidebook is, because it is timely. It's a resource that we all need to decarbonize the health sector. And it's one that can enable collective action on this decarbonization goal. So next slide, please. Now, Dick has eloquently discussed already the issue of climate change and human health. We all say that it's a public health crisis because the toll on human lives is much greater than anyone imagined. Globally, if you all in everything climate related, you're talking about 20 million deaths a year. United States, we certainly have hundreds of thousands from air pollution and heat-related stress. You just heard about the Canadian fire and smoke and all those unhealthy things. And of course, we all know this slide coming from the consortium, Medical Society Consortium of Climate and Health, maps the different climate effect in different states. As you can see, there's nobody is actually immune, can escape the climate effect. And you already heard many of the effect that includes not only pollution, extreme weather, but vector-borne disease, rising ocean, many other issues. So all told, the costs estimated in 2021 for healthcare cost and climate change top $820 billion annually. So when I realize all this data, it's very clear to me that we should act, and being the neutral convener, I feel is an opportunity for me to take advantage of Walt and Dick and many others, but try to bring people together to see if we can act collectively as a group for the nation. Next slide. So I think Dick's already talked about the fact that we emit 8.5% of US carbon emissions. And as he said, 20% of GDP. But, you know, if you look at our contribution globally, we're about 4.6% of global carbon emissions. So it's huge what we do in the United States. And of course, you all know about scope 1, 2, and 3. Suffice to point out that, in fact, scope 3, which counts for at least 70%, not within healthcare itself directly, but in terms of the things that we purchase, the thing that we do, and the supply chain from manufacturing, transportation, you name it. So in other words, if we're going to decarbonize the health sector, we need everybody on board. We need hospitals, healthcare without harm. We need to look at our source of purchase of energy and heating, but we also need the private sector, particularly pharma, biotech, device, supply chain, to be all saying, let's work together, or else we're never going to reach our goal. Next slide. So that's how we got into this whole thing. And again, I thank the same people, among others, including Charlie Halpern, who certainly woke me up on this issue, and others to say, let's do something about this. Now, in the Academy, we've only done Grand Challenge once, which is, the Grand Challenge means it's a huge, bold project that includes many parties. So it's not the old, has been said by both Walt and Dick about the old reports that we do. We want to bring people together, public, private together, to address an issue together as a grand challenge. Of what greater challenge than climate change? So our grand challenge, which is chaired by G.D. Roden, who was the former president of Rockefeller Foundation, known for her work in resilience, lead this whole thing, and we have 5 strategic pillars. And this is what I want to talk about, because this is all what you guys are doing in the guidebook is really relevant to all this stuff. We recognize, first of all, communication. Really, has been said by Cecilia, it's much better now, but when we first this journey, we were quite lonely. There are not a lot of people, I'm sure when Healthcare Without Harm started, there are not a lot of people who talk about this. Over the last 3-4 years, it's really great to see how many people have jumped in. But I feel it's not sufficient, because the communication has to be to the public, to realize your lives are being affected. It's not only your grandchildren, it's right now affecting everybody. And after all, what do we care most about in our life is our health, our well-being, and others. So that message is really important. So communication as both to the public, but also to the educators and to the healthcare professions training in terms of medical school, nursing school, health professions, so that they can be not only messengers, but they can also practice, a good practice of low carbon emission. Second one is called the Roadmap for Systems Transformation. This one, what we're looking at, in fact, is looking at the fact that agriculture, energy, transportation, all these things affect climate and health. But yet, each one of these sectors look at their issue vertically from consumption to emission to mitigation, never really measure what it does to human health and human well-being. So we decided we should bring them all together to create a new macroeconomic model which focuses on human well-being, hence the systems transformation. And we're doing a major international commission on this area. Skipping over to the far right is research innovation. Well, you know this. I mean, we need a lot of research innovation. I won't have time to talk about this. Now, I think the real interesting thing for this group is to collaborate with the decarbonized youth health sector and to work with the communities, especially the communities of color, marginalized, socioeconomic impaired community, which are greatly suffering disproportionately from climate change and environmental injustice. So I want to spend the rest of my time talking about this. Next slide. So again, with the help of Dick and Walt and many others, we launched this Action Collaborative with the idea that we're going to bring people from public and private sector. We convene. And it's all mainly in the health sector, of course, but we want to collectively to say we have a shared action agenda, and we were going to work with this footprint. As been said, it may be difficult to reach 50% by 2030 reduction, but maybe we have a chance by bringing everyone together to work for the same goal. So you can see that it's truly a public-private collaboration with Rachel Levine, Assistant Secretary of Health, overseeing OCHI, Office of Climate Change and Health Equity, as a co-chair. George Barrett, Supply Chain, the largest, Cardinal Health, and he's a great member. Andrew Whitty, who used to be CEO of GlaxoSmithKline and now United Health Group, the big payer group. So the four of us, together with the steering committee, really begin to move towards how do we do this. And you can see our members really represent everything. Hospitals, clinicians, payers, distributors, companies, education, the key media. Next slide. And so how do we do this together? Well, we break them into 4 groups, 4 working groups to focus on what can supply chain do. And can you see my video? Okay, you can't see me, but that's okay. What can supply chain do in terms of their role? What can healthcare delivery do in terms of when we deliver care to patients? What do we do about reducing carbon footprint? The waste reduction, the change in anesthesia gas, looking at the remote delivery. What about education? And of course, we all recognize to do all this, if you don't have the right financing policy incentives, it's going to be very, very difficult. When I speak to my friends at CEO of hospitals or health systems, they say, I'm so busy with COVID, I don't have enough nurses. Do I need to do this? So we recognize that compelling case is not enough, but actually enabling is important. So we'll talk about the Inflation Reduction Act, and certainly we'll begin to look at how that can be deployed to help institutions to decarbonize. But also, Liz Fowler, who's the head of Medicare, Medicaid Innovation, is chairing this along with Don Berwick and John Perlin, the head of Joint Commission. So the 3 of them, of course, are thinking hard about, as Liz says, we're going to begin to think about providing, payment in terms of value-based payment, being able to measure that, in fact, you are not only the outcome, but this is one of the outcomes that needs to be measured. And of course, Don Berwick was so great, think about how do we make sure that that works in a sense. And of course, we worked on financing. And of course, John Perlin's thinking about, well, what does Joint Commission do? Finally, we wanted to get as many people under the tent as possible. So we created the idea of network organization to enable anyone who want to join us to learn about this. They don't have to work on metrics, decarbonization. They just need to be able to access our information and learn from each other. So that is, in fact, the structure. Next slide. So I think this is where the guidebook comes in so importantly, because as we look for how to decarbonize healthcare delivery, I think the key issue, which is not listed here, is in fact this important guidebook, because the guidebook provides strategies to help hospitals to substantially reduce the operating cost and to meet decarbonization standards in California, and of course it can apply anywhere else. And I'll come back to that. Education, I already talked about. We're trying to create curriculum, look at gaps, and have health professionals to understand this and practice it. Next slide. By the way, in the healthcare delivery, I'm sure you already read waste reduction, many other issues. Supply chain, well, the good news is, even cautiously, we do have a lot of people joining us. And what they want to do because of potential SEC rules, but also ESG, they want to say, okay, our company is understanding sustainability, resilience. So they begin to come together, say, yeah, for us to do that, how do we standardize ourselves and how do we deal with regulatory issues? Because every time we try to be innovative and try to do something that reduces potential carbon emission, FDA makes us do it all over again, testing everything. So it stifles the willingness to do a lot of innovation. They created climate journey map, which is an interactive infographic to help companies to look at their journeys, case studies to showcase good examples. And finally, I already mentioned policy, finance, and metrics. They're doing carbon accounting clinics to allow people to learn how to do this. Next slide. I think this book is so important for exactly that reason, because it can be used as a reference tool for hospital owners, operators, and designers, and architects, engineers, and regulators. It can help any interested stakeholder understand the benefits of minimizing natural gas use, reducing greenhouse emission. It offers a clear strategy to reduce system loads, electrifying what remains, and move towards renewable energy, and provide examples of technological help that may support these efforts. It certainly encourages cultural momentum to get staff on board with these issues, and it considers importantly the financial strategies that can be used to implement this. Without that, I think we can all talk all we want, but these things are what's needed. It's the how, and the how comes along with not only this guidebook, but as I said, financial strategies and an ability to tell leaders in healthcare, not only you're doing the right thing, but you're actually improving health. Imagine that we have patients being taken care of in their community at home with virtual care. They don't have to drive to and consume a lot of, emit a lot of carbon to clinics. That is much better in terms of prevention and promotion, and of course, community care. Next slide. I'm going to end by saying we're starting our next phase in January, and with their help, with my colleagues' help, we have now decided that what we like to do is to create national movement. Let me say one thing first. What Cecilia said. You know, IHI is part of this, Kaiser part of this, of course, Healthcare Without Harm, and more people are entering. And the way I look at it, we are actually a shop that's open. We embrace everybody's effort, not competing, and we support everybody because what we need is everyone to be working this together. So our movement is to say, how do we have the usual, if you will, hospitals and others that have not been aligned or, connected with this whole idea to do this? So Don Berwick, Joe McCann, and IHI have done so much because you all know, I think of these like the early days of patient safety and quality, right? Academy 20 years ago say to err is human, we're killing people, medical errors. And then Don Berwick jumped in and say, I can really start a campaign called 100,000 Lives Waste No Will campaign, which is, and of course, where we are today, anybody who goes to a hospital clinic knows that they're going to check your date of birth, they're going to check this and that. It becomes part of it. And at the beginning, it was the same resistance. So what we want to do, next slide, is to say all health systems can join us. And our plan is the following. We have about 50 hospitals, of course, then Health Department doing a lot of that too, joining to be measuring everything because they are all ready and they're already doing this. Then what we want to do is to open up for everybody to say, we want to join you. All we need for you is a commitment that you're going to work towards this. This way, everybody feels as democratization of this issue, not standing back, and together we can begin to see the movement that have changed, certainly patient quality and safety, learning from our own experience and that of Don Berg and others. So this is the last slide. Health systems, stakeholders, and the entire sector must work together. Create models, share lessons learned, and the collaborative support of community practice. And I think this guidebook is really timely and important resource. So I want to thank Mazzetti Group and others for doing this. Do I have another slide? Is that the last one? Thank you.
Dr. Zhao, thank you so much for that riveting presentation and for putting the guidebook in context. While the guidebook did have authors, in some senses it was a coming together of this community here that is here for the launch, as well as hundreds of others who participated in different ways. And so we thank you for putting our work on the guidebook in the context of the overall academic and clinical picture for the United States. Thank you for your leadership at a national level, and thank you for inspiring us today. We have a couple of minutes left, so we want to do three things rather. The first is I want to quickly talk about a motivation program. We're talking about this because as part of the guidebook, we recognize that we want to encourage other healthcare organizations and indeed our own healthcare organizations to engage in reducing carbon in healthcare. The guidebook will help us with the how, but we want the human power behind it. And so we want to highlight here a program by the International Federation of Healthcare Engineering. That is the IFHE Carbon Challenge. The International Federation of Healthcare Engineering is running a challenge which will allow you to compare your 2021 carbon emissions to your 2023 carbon emissions. Hospitals and other healthcare facilities that reduce by 5% will receive recognition and an award. And then there is an award in each category at the national level as well as at the international level. Signing up for IFHE Carbon Challenge is easy. You can go to the site that I put in the chat, and winners will be acknowledged at the IFHE Global Congress in 2024. The other opportunity here is to have access to a dashboard that will allow you to compare your energy and carbon emission data for your facilities. And ultimately see where you are in relation to the averages for your country. In our case, the United States. And so the reason we're highlighting this opportunity to engage is that when you are engaging and cutting the carbs and you can measure it and you're comparing with others, there's an opportunity for both you to encourage your people to join in this effort to reduce carbon, as well as to encourage your peer organizations. Ultimately, we want to create a competition that will allow you to see as you reduce carbon. On the screen, Charlie has the sign-up information to see how quickly and easy it is to sign up, especially if you're already a member of Energy Star. You fill in your facility information, you link to your Energy Star information, and then you'll have access to the guidebook. Right now, the site is based on energy. In September, it will move towards carbon. In October, I believe, you'll be able to put in your own carbon factor, and you'll be able to monitor your changes in carbon emissions. Whatever you do, we want you to be motivated as you use the guidebook. I also want to highlight that there is a motivation section in the guidebook and that there are tools for motivation. So as we start at this launch event, I want you to be motivated to improve carbon for healthcare and for the world. Next, we have the moment we're all been waiting for. So I want to encourage you, if you have a daytime drink that you might want to use to toast, you can grab it. I have cherry pomegranate sparkling water, And I want to encourage you, if your camera is off, to turn it on. This is as close as we get, but it is a near carbon neutral way for us to celebrate the launch. When the Decarb Guidebook team talked, we talked about this idea of having a champagne bottle and smashing it against a ship. And we wanted to create a moment that was like that, but indeed online. And so this is our attempt. It is our attempt, and we can make it better. So in a moment, I'm just going to ask us to lift our glasses and to toast the launching of the Decarb Healthcare Guidebook. Cheers, everybody. The guidebook is launched. The official link is in the chat, and now I get to turn it over to Austin, who is going to give us a demo so you can see how easy it is to use it. But first, Bethany, thank you. Let's clap for the launch of the guidebook. As Austin takes over, thank you so much. I just spilt water over everything. Thank you so much to everybody for all your efforts. I see Monica and others who participated in workshops on the line here and who led workshops. Thank you, everybody. Austin, over to you.
Thank you, Troy. Thank you, everyone, for being here. This is the moment we've all been waiting for, and I'm going to try to get as much of a tour of this guidebook to you as possible over the next 8 minutes. You'll go to, if you've clicked the link already, you're probably already on this landing page for Decarb Healthcare. As we scrolled through the landing page, we highlight 3 key points: reduce, electrify, and advocate, as the three answers to the question of how do we decarbonize our healthcare buildings. There's a couple other ways to engage. There's other features on this homepage that will change as the guidebook is being used by all of you, including latest content that's been added, trending conversations and topics, and most popular sections. So I'll invite all of you to come and click register and create an account. And when you do that, you'll come here, you'll have an onboarding where you can talk a little bit about, answer some questions about yourself. And then you are registered for the site, and you're free to explore. The guidebook, there's tabs across the top, but the guidebook itself lives here in the guidebook tab, and you'll see down the left side is the table of contents and the roadmap for this resource. There's a welcome section. I will direct your attention to the approach section. I think one of our main goals of this guidebook was to educate our healthcare owners, our consulting engineers, design engineers, our architects, and really everyone that finds themselves part of this Decarb community. And it starts with framing the general approach to decarbonization. And we wanted to portray some key points, some strategies, and define some terms, and also provided a background for how to engage and how to consume this information. So as you go through, read through this approach, and it'll include some nuances about new construction versus existing buildings, energy resiliency, as well as financing decarbonization. The meat of this guidebook is really in these technology sections. And so as you go through the technology sections, if you've been following us back from the beginning, you may recognize that these technology sections follow a similar pattern to our workshops, and that has been the framework that we've followed, and it's really the framework in this approach, which is reduce your loads, electrify what remains, and then use renewable energy for that electrification as the key strategy. So the first section we have to talk about is load reduction, reducing loads, minimizing our reheat in our buildings, VAV, retrocommissioning, and other strategies you can find there, as well as efficient ways and decarbonized ways to dehumidify your facilities. We also look into central plant. Once you've made your buildings as lean as possible, we want to look into the central plant and what does a decarbonized central plant look like? I'd like to think there's going to be a giant space where the gas-fired boilers used to be, and now what's going to replace that? And so we look into things like heat pumps, heat recovery chillers, solar thermal, and other strategies. We have a section on domestic hot water, a section on steam, alternative steam methods. What if we didn't use steam, and then converting your old steam boiler plants to hydronic plants so that we could eventually get rid of those steam boilers, as well as looking into thermal storage and load shifting strategies. There's a lot of content here. I invite everyone to go through and read and comment. One of the really exciting parts about this guidebook that makes it different than most other paper guidebooks is the online community aspect of it. So you're able to go on and like and comment on an article. And so I'll just paste a comment that I wrote ahead of time. But this is as easy as commenting. And now anybody is free to go comment and continue the conversation directly on the page where the content lives. And so each one of these different sections has its own comment kind of thread below it. And so that's where we want to encourage you to have those discussions with others and use the guidebook in that way. We have some other sections here, the motivation program. There's some information on the carbon challenge, as well as the health sector climate pledge, and then and some financing strategies. How do we pay for it is a common question that we get. And so there's a lot of strategies here that go beyond just looking at looking at simple payback or trying to pay for it with energy savings. I will also direct your attention to the Decarb strategy tool. It's a custom strategy tool that will come up with a narrative and provide you with a narrative for your facility. So you can enter your facility's name, a city, should have pre-populated that, and your role at the facility. And then whether it's existing or new construction, whether it has steam or hydronic or other heating source, and then which climate zone it is. And when you hit finish, it'll generate a strategy that will customize to your location, your situation, and your building. So please check this out. This is meant to push your narrative, your facility, your organization in the right direction towards decarbonizing your facility, and we hope that this is helpful for you. And then lastly, when you create an account, there you have a dashboard and where you can see all the pages that you've liked. It'll ask you a few questions about your preferences and what you're interested in terms of decarbonization, the different topics that we have, and so it'll recommend you articles there, as well as some recommended readings and different tracks for how to read this rather than just trying to go through from top to bottom. So we've really tried to find different ways for you to experience the guidebook, and we're really excited for you to use it. I did it, and I have 1 minute to spare, Troy, so I'll give it to you.
Great. Thank you, Austin, and thanks to all of you. I have 30 seconds to give some special thanks. And so I recognize I won't hit everybody, but I wanted to especially thank the California Energy Commission for having the vision to put this together. To Amir and Bradley, thank you for your leadership. Obviously to Dr. Jackson and Dr. Joust for those, not only those compelling presentations, but their overall leadership in this nation's quest to reduce the carbon impacts of healthcare. I have to give a special shout out to Jim Crabb and to Charlie, to Austin, to Cassidy Thompson and the team that was working tirelessly day after day on the guidebook. Yes, thank you, Dr. Jackson. Let's give them a round of applause. And finally, to all of you, I want to remind you of two things. Number one, I put in the chat, there is an opportunity to reply to Austin's comment or post a new comment on the guidebook and to receive a prize. Number two, I'm happy to report, as I thank Jess, who is here on maternity leave, but here for the launch, that she did a great job of helping support the guidebook and was another person behind the scenes and reported the AIA credits are available for this presentation. So if you are an architect and need AIA credits, one HSW credit is available. If you provided your AIA number, you will receive it. Thank you, everybody, to Practice Green Health. Cecilia, thank you for representing. To all of you, thank you so much. Take care, engage in the guidebook, share it with your friends, and enjoy the start of this journey. Thanks, everyone. Take care.